Welcome to the November 2020 edition of the Dr. Fazil Show. And since we're in the winter seasons, we're going to discuss how to combat the flu and the coronavirus at the same time. Today we have award winning Dr. Fazil with us, and since we're not in close proximity, we will not be wearing our mask today.
Thank you, audience, for having me in this show today and watching our show. Um, so, as Jose said, the topic of the discussion today is uh, as we know, we are in uh, deep winter, and in every winter, we do get cases of flu, just like the last year and the year before that. But this year, 2020, is different than any year in the past because we have a pandemic of coronavirus uh, along with flu cases, which generally happens in winter anyway. And this winter we are having to have combat both diseases at the same time. And first thing is that I need to our audience to know that we are still learning this disease um, every day. Things which were true yesterday are not true anymore because this is a new virus, and as it spreads, um, and with the different change in climate, we see different symptoms, signs, and so we are learning to uh, find new features of this disease. One of the important differentiation between flu and coronavirus is that it is not seasonal. The coronavirus, as we thought, will go away in the summertime when we got it early cases in January of 2020. That didn't happen, and this was kind of like unlike flu, which generally happened in the winter time. So that was obviously a little bit scary because that was our one of our safety net that it will just go away in the heat of summer. It didn't happen. We do know that the coronavirus spread through um, close contact and through respiratory droplet infection inhalation. So basically, the mode of spread is droplet infection inhalation. And at the same time, flu spread through the same means. Uh, the difference between the contagiousness and the flu is that coronavirus is more contagious. It is 3 times more contagious than the flu virus. So that's the one important difference in how it spreads. So we do know that 6 feet of social distancing, wearing mask, uh, obviously prevent to get the infection. Um, that should also prevent the flu at the same time. But again, we have another arsenal for flu for a very long time. We do have flu vaccine, which get manufactured very early in the year because each year the flu vaccine is different than the flu vaccine from the last year. And the reason is that flu virus mutates, but it mutates once a year because it only happens in the winter time, generally from October till April of the next year. So we have enough time to uh, understand the new strain of the virus and make a vaccine appropriate for the upcoming flu virus with the new mutation. Now, uh, we have not had chance to do that with coronavirus, and since it's not seasonal, is throughout the year, then one issue I'm seeing is that how the vaccine is going to combat the mutation change, because with the flu, as we said, it's once a year. Um, this is throughout the year. Mode of spread is the same. Coronavirus is more contagious. Flu infection is less contagious. So my recommendation would be as follows: we can actually prevent flu by what we have done in the past. Just take the flu vaccine, and that's why I highly recommend that all the patients they should consider taking flu vaccine. Now, one of the most common rejection I see from a lot of patients is that we never get flu. We have never got flu vaccine in the past, and in the past, we let it go. We said, okay, that's fine. It's the patient choice anyway. We can only recommend. But this time, we highly recommend that even if you did not get flu vaccine in the past, you should get flu vaccine at least in this year. And the reason is because let's say if they get coronavirus infection and then they get flu unfortunately at the same time, or you get coronavirus and then it lowers your immunity and you become more susceptible to flu infection when you were not susceptible to that infection in the past because of strong immune system you have, it might not be true this time. So definitely we do not have two enemies to fight with at the same time. My recommendation is go ahead and take the flu vaccine, even you might have not got in the past, unless you have some very strong contraindications to the flu vaccine. If that's not the case, then you should go get the flu vaccine, and let's get this thing on the side, and then we can work on the coronavirus. Then we have one infectious disease to fight with, that is coronavirus, and not both.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
And Dr. Fazil, can you discuss how to determine if it's a flu symptom or if it's a coronavirus symptom?
Well, I will say it is two different spectrums of the same family of viruses. One of the things which we have found in coronavirus infection is that people have loss of smell and taste sensation. The flu infection would not give you those symptoms. Typical flu infection will present with fever, headaches, body aches, sore throat, and it tend to gets better over a period of time. Coronavirus sometimes have no symptom at all, and we have seen that in young patients, coronavirus might not have any symptoms at all. So if you do get symptoms, I think the question is if you do get symptoms, then especially in the winter, because you don't get flu infection in the summertime. So if you do get symptoms of flu-like symptoms, and I'm saying flu-like symptoms because there's broad conditions which can look like flu, like headache, fever, nausea, vomiting, or cough, shortness of breath, runny nose. All those things could be seen by other cold viruses besides flu. So we have coronavirus, we have other cold viruses, and then we have flu virus. So the question is how to clinically, like by just talking to the patient or examining the patient, how would we differentiate between one or versus the other? So first thing is, if you have already a flu vaccine done, then unlikely you will not have flu. That's unlikely. You can still have it, but unlikely. So that's the first question I would ask: did you get the flu vaccine this year? And if they have it, then they would be unlikely to have it. Now we also have a rapid flu test in most of the doctor's offices, so we can check with the throat swab if they have flu infection or not. With the coronavirus, they might get flu-like symptoms like fever, headaches, not feeling well, body aches. In addition, that classical symptoms are loss of sense of smell or taste. And I've seen some cases where they have lost weight, and we didn't know if they was having something else going on till we did the coronavirus test and found that they have a corona infection. And once appropriate measures was taken to combat that infection, the symptom reverse. So yeah, it can present not just like flu-like symptom, but besides flu-like symptoms. So yes, question number one: did you get the flu vaccine? If they did it, unlikely they did not have flu. And if we're still doubtful, we can do a quick test in the doctor's office for flu. And if this is negative, then unlikely they have flu. But then we are left with those two infections. Either they have COVID-19 infection, or the patient would have other cold infection. And sometimes they can have bacterial infection like pneumonia, which does happen very commonly, mostly in the winter time. So we have to be vigilant. So we still have to practice social distancing and put the mask. And again, we said in the start of this TV show today that I'm not wearing a mask, and Jose is not wearing mask because we're not in close proximity to anybody at this moment. So mask was not necessary. But I do recommend all my patients and our audience that as per CDC guidelines, we stick with the guns and keep wearing the mask 6 feet apart, and social distancing should be practiced more rigorously, especially now when we are in the winter season.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
And Dr. Fazil, have you seen any new symptoms with the coronavirus over the last couple of months?
Yeah, so the new symptom which came up recently is, and we've seen that symptoms before in children, the Kawasaki disease, where they were having a heart condition or heart attack or heart failures. And the children mostly, they don't have that the plaque built up in the blood circulation to the heart. So we do not expect that kind of conditions in children, but it was happening. And lately we have seen that it is also happening in the adults as well. And sometimes it's permanent. How does it happen? it happens. We know that the coronavirus does affect lungs, and heart is an organ which is enclosed between two lungs, so it can indirectly affect the heart, because if the lungs get infected, since the heart is touching the lungs, it can get infection from the lungs into the heart. It can also go from the blood circulation directly into the heart and cause heart attacks and rhythm disorders and heart failures and various other heart dysfunctions, which was never seen in the early phase of this epidemic. So as we said earlier, we are in unprecedented times. This is uncharted territory, so we have to stay vigilant all the time. So if you feel sick, or if you have any symptoms which you are not sure what's going on, I highly recommend to contact your primary care doctor.
Thank you for watching the November 2020 edition of the Dr. Fazil Show. Stay tuned for our December 2020 edition of the Dr. Fazil Show.
Thank you our audience for watching this show. Stay safe, and we'll be back next month with the new information, new topics, and more updates on coronavirus.